Okay, now come to the nerve supply of the ear. Okay, so at first it will go that nerve supply of the face. And what is the most important question? The most important question in the nerve supply of face is what is supplied by the tip of nose is supplied by which nerve, and the angle of jaw is supplied by which nerve. So let us see, it is our face, and let's draw the dermatomes. The face is mainly supplied by our trigeminal nerve, that is fifth nerve, cranial. Now it has many branches, V1, V2, V3. These nerves are here, looks like this. It is our frontal part, it is our occipital part. So if we take this, this is the first V1, that is ophthalmic part of our trigeminal nerve. So it comes like this. Obviously it is ophthalmic nerve, so it covers the eyes like this. It covers the eyes and come forward and makes the tip of the nose here. This is V1. So if it is looks like very much, so the tip of the nose, it is done by V1, that is ophthalmic branch, that is V1. It supplies the tip of the nose, ophthalmic branch of fifth, five, trigeminal. We know it is obviously face is mostly supplied by trigeminal nerve, but we are not sure what will be next. Next comes the maxillary part. It is supplied by V2, obviously, and also named as maxillary branch. So it is comes like this and comes to the upper lip. Actually, here is the our upper lip. So comes to upper lip. It is V2. This is the maxillary branch. And last is obviously the mandible. The mandibular branch comes like this. Gives the ear a little bit here and skips this part, that is angle of jaw, the shaving area, and gives the rest of the part, that is this jawline. Okay, this jawline obviously part of manlyhood. Sharp jawline is obviously part of manlyhood. So this part is given by auriculo temporal nerve, that is a branch of mandibular nerve, which is a branch of trigeminal nerve. Okay, so it is the V3. Okay, so this teeth, the temporomandibular joint here, it is actually like this, and here comes the temporomandibular joint. So it is the temporomandibular joint, that is the TM joint. Here the teeth. The anterior two-third of the tongue. Here lies our tongue, right? So tongue's the anterior two-third part of tongue. Here comes the posterior two-third. Here is the anterior two-third. All of this is supplied by ultimately auriculotemporal nerve. Light is slow. All of this is supplied by auriculotemporal nerve, that is a part of mandibular nerve, which is a part of trigeminal. Yes. Okay. Then the next things comes then. What is supplied by the first question? The tip of nose is supplied by ophthalmic nerve of trigeminal nerve. Now the second question comes, that what is supplied by the angle of jaw. It is the angle of jaw, also called the shaving area. So what it is supplied by which? Okay, so let's do it. If we take this part, it is the occipital bone. So obviously it is supplied by occipital nerve. Mostly occipital nerve is like this. So this occipital nerve is called greater occipital nerve, supplied by C2. There is a cervical chain we have like this. In this middle area, we have from the angle of jaw to here, obviously we have the neck, angle of jaw, most of the ear, it is entirely covered by C2, C3. C2, C3. C2, C3. The name is greater auricular nerve. It is greater occipital nerve, it is greater auricular. So let's complete the picture. This is our picture entirely. Okay. Here is the neck, obviously, and everything else. So this is the nerve supply of the entire face. The main two questions. Here comes the word greater auricular nerve, that is EN. It supplies most important angle of jaw. The rest of the jaw is supplied by V3 auriculotemporal nerve, but angle of jaw, that is also called the shaving area. It is supplied by greater auricular nerve. Most of the entire pinna. So our pinna mostly supplied by greater auricular nerve. How? Let's look at the pinna. So we have already a picture of pinna. This is our pinna. It is the external auditory meatus, এক কথায় ফুটো। ফুটোর আশপাশে যে খালটা আছে, এটাকেই বলা হচ্ছে যে খাল মতো যেই জায়গাটা হয়ে যাচ্ছে, এটাকেই বলা হচ্ছে কঙ্কা। কঙ্কার দুটো পার্ট, এটা হচ্ছে সিম্বা কঙ্কা আর একটা ক্র্যাম্বা কঙ্কা, কিছু আছে এটার নাম। এই গোটা জায়গাটাকে বলা হচ্ছে কঙ্কা, ফুটোর আশপাশে যে খালটা আছে, আর বাকি এইটা হচ্ছে আমার কান। এবার কানের most of this part entirely, just leaving the concha part, most of the lateral part continuing from this and lobule, like including this lobule lateral part, and also the exact opposite posterior part. All of this is supplied by greater auricular nerve. Again. Okay. So this lobule input. So if there is a ear piercing done here and it is torn, we will do what? Lobuloplasty. Lobuloplasty. Plasty. Which nerve should be then? We have to make sure. We have to make sure about greater auricular nerve, that is greater auricular nerve C2, C3. We have to make sure about this. Then what about the Simba and Conca? This part. Okay. This part is supplied by this entire part. It is mostly supplied by vagus nerve. This is 10th nerve. Auricular branch of vagus nerve, it is called Arnold's nerve or Alderson's nerve. This is called Arnold's nerve or Alderson's nerve. This part. Now, the superior posterior part of the photo, that means this external auditory meatus, it is supplied by facial nerve. Okay. So let's make it. So if we draw the picture here, just like that, it is our ear. Okay. It is the tragus. It is the under the tragus. I have actual thing shaped. Now let's do this entire. It is the helix. It is the lobule, and I have my concha. This entire part supplied by greater auricular nerve. Again, this first part, that is the anterior part, this anterior part, it is supplied by auriculotemporal nerve, that is only this frontal part. Also the frontal part is actually supplied, that it means tragus. Tragus is also supplied by auriculotemporal nerve. Okay. The remaining part is obviously lobule. It is supplied also by the remaining part. Inter. Only this concha it is supplied by vagus nerve. Vagus, that is 10th nerve. On your supplied by the 10th nerve. So we have here auriculotemporal nerve is also part of trigeminal nerve, that is the 5th nerve, and here we have the 10th nerve. Okay. Now comes the inside part of the here is the 10th under. Okay, not above. Okay. Now if we see the inside of this canal, then we will find that the external auditory canal is supplied here. The vagus nerves comes and gives its punches to the concha area. fixed teeth. It also gives the floor of the floor and obviously the posterior part. And what is given by the roof? The roof is given by fifth nerve, also the auriculotemporal nerve. The external auditory meatus, the roof, and the anterior part, it is given by this part. Now comes the our tympanic membrane. Now the tympanic membrane is also given by both of them. This the lateral part of the tympanic membrane is getting its lateral surface of the tympanic membrane getting its nerves from obviously vagus and auriculotemporal nerve. Vagus nerves, the auricular branch of vagus is called Arnold's nerve, also known as Alderson's nerve. Alderman's nerve. Now, it is the lateral surface of the tympanic membrane. The medial surface, obviously, getting from another. What is that? We know from the medial wall there is ninth cranial nerve, that is the glossopharyngeal nerve, and this is making the tympanic plexus. So it is named after Jacobson's nerve. So the medial part is made by ninth cranial nerve. The ninth cranial nerve, also known as, what to write here, the entire part is given by this entire part is given by ultimately Jacobson's nerve. This is the medial surface of the tympanic membrane as well. Okay. So this is the entire nerve supply of tympanic membrane. Now what questions comes? There is two questions already. The tip of nose is given by ophthalmic nerve V1. The mandibular angle of jaw, that is the shaving area, it is given by greater auricular nerve. This is the most important both questions. Now extra questions. Here follows the extra questions. That is the referred pain. What about the referred pain? I will say. In the entire inner ear, I have seen no nerve supply. So there is no. I have seen nerve supply, but there is no sensory nerve supply. That means there is no sensory nerve, so there will be no referred pain in the inner ear. So no referred pain. You can write here. No referred pain in inner ear. But I have seen many nerves in the external auditory canal, in the middle ear, and obviously in the middle ear, and so there will be referred pain. So which referred pain I will get from where? Okay. So let's look at this. These are triggers. Obviously. So triggers is supplied by auriculotemporal nerve. It is also auriculotemporal nerve. So triggers, that means this part is supplied by auriculotemporal nerve. So pain, if feel in triggers, where the damage comes from, the damage can come from the temporomandibular joint, the teeth, the anterior two-thirds of tongue. Tongue has many supplies. The anterior two-thirds is also supplied by chorda tympani, and the posterior one-third is supplied by the glossopharyngeal part. This is the taste sensation. I am talking about the general sensation that is coming. Anterior two-thirds is from the auriculotemporal nerve. So any damage in the temporomandibular joint, in the teeth, in the auriculotemporal, in the tongue, অর্থাৎ মেরে মুখ ভেঙে দেয় যদি, বা দাঁত ভেঙে দেয় যদি, বা জিভ টেনে ছিঁড়ে নেওয়া হয় যদি, তাহলে আমার ব্যথাটা কোথায় হবে? আমার ব্যথাটা হবে ট্রিগাস। নেক্সট পার্ট, এখানেই আমার আছে প্যারোটিড গ্ল্যান্ড অ্যাজ ওয়েল। তার মানে আমার ব্যথা যদি এখানেও হয়, তাহলে অরিকুলোটেম্পোরাল নার্ভ ইনজুরি, ETN 5, auriculotemporal nerve. The damage can come from where? TM joint, obviously I have seen TM joint, temporomandibular joint. I have seen the parotid, here lies the parotid, parotiditis, parotid, so itis, obviously parotiditis, infection in parotid or any tumor in parotid, obviously anything with parotid. Dental conditions means teeth, dental conditions, and obviously tongue, TTT, anterior general sensation, if damage is done here, okay, মেরে মুখ ভেঙে দেওয়া হলো, মেরে মুখ জবড়া ভেঙে দেওয়া হলো, মুখ ভেঙে দেওয়া হলো, দাঁত ভেঙে দেওয়া হলো, অরিকুলোটেম্পোরাল নার্ভের জন্য আলটিমেটলি আমার ট্রিগাসে, এই ট্রিগাসে আমি ফিল করবো কোথায়? ট্রিগাসে। Okay, this is the first question. Second question comes that Jacobson's nerve. Okay, I have no space in here. Okay, so whatever means that the ninth cranial nerve is also here, glossopharyngeal nerve. It gives the Jacobson's nerve. The Jacobson's nerve gives the temporal joint. It gives also where? The Jacobson's nerve gives in the entire oropharynx and middle ear. It is supplied by the Jacobson's nerve. Here comes the anterior 2/3, the posterior 2/3 of 1/3 of the tongue, and also other places. Just check this entire picture, the soft palate, the posterior 1/3, the tonsils, and the tonsils, obviously both tonsils, it is entirely supplied by ninth cranial nerve, that is glossopharyngeal nerve, its branch Jacobson's supplied to this entire thing, including the middle ear. And the anterior 2/3, anterior 2/3, anterior, this anterior 2/3 supplies by auriculotemporal nerve, that is also the mandibular nerve, which is also the part of fifth trigeminal nerve. Now comes also the second part, it is the general sensation. What about the taste sensation? So the taste sensation for the posterior 1/3 is obvious, same as Jacobson's nerve, and anterior 2/3, the taste sensation is on chorda tympani, which is also a part of facial nerve, that is seventh facial. So any pain in the tonsils, any acute tonsillitis, any peritonsillar abscess, any carcinoma in the tongue of or tonsils, that is oropharynx, the pain will be referred through Jacobson's nerve. So if I draw the oropharynx like this, let's make the entire thing pink. My entire oropharynx looks like this. Here comes my tonsils. So, tonsils is the anterior two-third. Anterior two-third of tongue is given by auriculotemporal nerve 5 and chorda tympani, that is the 7th, that is the facial nerve chorda tympani. It's the facial nerve. It is the facial nerve, so facial nerve can be written as 7. And this entire part, it is the tonsils, soft, adding this tonsils, soft palate, also another tonsil, and the posterior one-third tongue. Okay. This is entirely supplied by 9th cranial nerve, that is glossopharyngeal nerve, that's branch Jacobson's. So in case of tonsil, acute tonsillitis, tonsillar abscess, anything termed with tonsils, any carcinoma in tongue cancer or carcinoma, cancer, I referred pain will go through Jacobson's nerve to where? To my external auditory cavity in the middle ear. Okay, so here is the middle ear. Okay. Supplied by this, and also my middle ear, that is Emilia incus stapes, that is this part. Let's write this also middle ear. Any problem with this will lead me to Jacobson's. Now next comes the question, larynx and pharynx. If we have this that is vagus nerve, Arnold's nerve or Alderson's nerve, if I have anything to do with larynx or pharynx or thyroid, I can feel that in conga. So larynx, hypopharynx and thyroid, pain will be felt in conga pain. So also while doing syringing in the ear or cleaning the external auditory canal, we can see coughing. It is also due to vagus. So coughing is also due to vagus. Next is cervical spondylitis. If I have seen cervical spondylitis here in the neck region, then I will feel the pain in the ear. Cervical spondylitis. I can feel the pain in the ear. Okay. Last is facial nerve. Okay. In case of acoustic pneumonia, In the acoustic neuroma, we have a small facial nerve innervation that is here in this part, in the photo posterior superior part. It is the anterior part. It is the posterior superior part. It is supplied by the facial nerve. This small part is supplied by the facial nerve. So in facial nerve supplies, posterior superior part of external auditory meatus. If there is decrease in sensation decrease, that is hypoesthesia, then it is a sign of acoustic neuroma, that is called Hilsberger sign for which acoustic neuroma, the external auditory meatus. Here only this part, external posterior superior part, is supplied by my facial nerve. And if there is hypoesthesia, that means decrease in sensation of the posterior superior part of external auditory meatus, অর্থাৎ ফুটোর posterior superior পার্টে যে সেন্সেশন কমে যায়, আমি কিছু ফিল না করতে পারি, দ্যাট ইজ কল্ড হিটসবার্গার সাইন, known as, that is referring to acoustic neuroma. That's all. That's the questions and that's the answer. So we have to remember three things. The questions: first, tip of nose is given by trigeminal nerve, ophthalmic branch V1, tip of nose. Angle of jaw, that is the shaving area. If while doing any kind of here also is parotid, so after doing a parotid surgery, my auriculotemporal greater auricular nerve C2C3, it comes from this part and it lies just beneath the skin. If any during the surgery, if by any chance if it is cut down, then we lost the part of here, the sensation is lost. So greater auricular nerve, angle of jaw, and pinna, mostly. If I give you the example, this is the, if we think this is as ear, okay, it is earbuds actually. So if we think this is ear, it is the front part, it is the back part. So most of this entire part is given by greater auricular nerve, that is GAN, and only the tragus anterior part along with tragus, it is given by our auriculotemporal nerve. Okay, and here lies this anterior part, it is little bit transparent, it is given by auriculotemporal nerve. And this part that is surrounding here my external auditory meatus, that means my photo is surround here. Around this part here comes my concha. This is supplied by 10th cranial nerve, that is vagus. This is by 5th cranial nerve, greater auricular nerve, that is C2C3. And this part is auriculotemporal nerve, that means it is supplied by anterior part, it is supplied by my 5th nerve, 5th, 10th. It is the posterior superior part, it is supplied by facial nerve. If any case I see there is no sensation in the posterior superior part, I will think about acoustic neuroma. That's all.